Hello, my name is Eve, and today we will be talking about anaphylactic shock. This occurs when an introduction of an allergen in the body binds to mast or basophil cells to release histamine. All right. Anaphylactic shock is a distributive type of shock. There is an issue with distributing blood flow. This leads to decreased tissue perfusion. Anytime there is decreased tissue perfusion, that is shock. We have to know which type of shock it is. It can be hypovolemic shock to why, it could be septic shock. But this form of shock of why your tissues are not being perfused, it's because histamine dilates your blood vessels so bad that blood is not able to get or return to the heart. If blood can't go to the heart, what is the heart going to be pumping? Air. I'm just saying. How are cells going to get perfused if there's no blood being pumped with these vessels dilating so bad that blood is literally just staying? There's no resistance or nothing. Your blood pressure is going to be low, less than 90 systolically. Your heart rate is going to be elevated because your body is going to go out with a bang. It's trying to work until it dies. So your heart is going to be beating fast. It's trying to pump blood, but cardiac output is decreased because dilated vessels. So histamine, it triggers vasodilation, it increases the heart rate, and increases capillary permeability. What this means is as those vessels dilate, they get leaky. So the fluid that's in your vessels, they seep out into the tissues. They leave the vascular system, the intravascular system, and they leak into your tissues like your face, your skin, and it causes swelling. Your fluid from your vessels are leaking, not your blood, it's the fluid. There's water in your blood, okay, but that's leaking out. And that's why when you see people with a allergic reaction or in anaphylactic shock, their face is puffy, their torso is puffy, and they're itchy. That water is being squeezed in your tissues. That's going to make you itchy. Okay. Histamine is going to also cause constriction. It's going to make it hard for you to breathe. This can lead to respiratory failure. Histamine also increases your gastric secretions. I say the body is trying to use your stomach acid to get rid of the allergen or the antigen, and it's going to create a lot of it. Contraction of GI smooth muscles. This is going to lead to nausea, vomiting, and pain. And this is like the body is trying to make you vomit it up, make a lot of gastric juice, try to burn it, and if possible, make you throw it out. So there could be some vomiting with this disorder. How does an allergen enter the body to cause this? Injections, orally, inhalation, or skin. Some substances that would trigger an anaphylactic reaction or foods like peanuts, shellfish, eggs, milk. Medications like contrast dye, vaccines, NSAIDs, and antibiotics, especially penicillin. All right, there are two different types of anaphylactic shock, okay? The first one is your immunological, and that's when your mast cells or basophil cells, they create antibodies toward an antigen. And when you come back in contact with that antigen, because your body remembers it, it's going to then trigger the reaction. So you don't know what your body is picking up and putting as a making antibodies toward, and when you go around, you get it's triggered. You never know. Okay? But immunological, your immune system is triggered by the antigen. All right. The other one, the other anaphylactic reaction is non-immunological, meaning the body does not have to make antibodies for you to get this reaction upon first exposure. What I mean, so you always been going to the garden, and then all of it. Well, that won't work. That would be more of your immunological, because it created an antibody. This would be like you trying peanuts for the first time and you get a reaction. Your body didn't make antibodies toward the peanuts for you to get the reaction. So you can get a anaphylactic shock from an antigen that's been saved by the body, or an antigen that has not been saved by the body. You never know when these things can happen. Okay. I should have said it like this. In anaphylactic reaction, immunological synthesization, the body needs synthesization of the antigen for the reaction to occur. An anaphylactic reaction that's non-immunological, synthesization is not needed. Your body doesn't have to store it. We just walked through that. Okay. Some things that would trigger the anaphylactoid reaction is anaphylactoid. I'm so sorry. Anaphylactoid reaction is the one that does not require synthesization. It's anaphylactoid. Okay, and the other one is anaphylactic. It needs synthesization for a reaction to occur. Back to anaphylactoid reaction, where the body does not have to store or make antibodies for you to get it to get triggered. IV contrast dyes will cause it, NSAIDs, and chemo agents. All right, and other things too. Well, these are the known ones. Signs and symptoms of anaphylactic shock. For the respiratory, you're going to have wheezing, swelling, upper airway tightness, because your bronchioles are being constricted due to the histamine. You won't be able to speak. There could be some coughing, watery eyes, stuffy nose. For the cardiac, the heart, you're going to have hypotension. Your blood pressure is going to be low because your vessels are dilated really bad. So a lot of histamine is being released to cause that massive dilation. Your blood pressure systolically is going to be less than 90. The heart is not able to pump anything. So what's the blood pressure if it ain't a lot of blood up in there to be pumped? Your heart rate is going to be increased because your body's going to go out with a bang. Heart is going to keep trying to pump, right? It's going to I'm not getting nothing. Let's pump fast. Let's get it up here. For your GI, stomach, there could be some vomiting, nausea, diarrhea, and pain. Okay? Because anaphylactic shock is going to cause GI. You're going to create more gastric juice. That can be painful. It's a lot of work that your stomach got to do to create all that juice to get you to throw up or try to burn the antigen. Now for your skin, there will be some itchiness, redness, and it will be swollen. We already talked about why it'd be itchy and why it'd be swollen. Red because it's inflamed. There's histamine promotes inflammation, and that water is going into your skin, cause some redness. It's called swelling. Okay. So interventions for anaphylactic shock is prevention. When you get a new patient, ask them what they're allergic to and share it with the nursing team so they will be able to help avoid placing that around your patient. Such as with dietary. Tell the kitchen they can't eat shellfish or peanuts or milk, eggs. So you assess that, you ask that document and avoid getting it around them, okay? They're on the missions, okay? Recognize the signs and symptoms and act fast. If you go in a room, you see the person wheezing, you seeing they face swole, and you know they just had a medicine, a new medicine. Stop the medicine. You gotta act fast, okay? We're gonna walk through. The allergen, what's causing the reaction? Even though we can try to get, I just hooked them up to an IV, and now you will know, okay? So if you find the allergen, remove it immediately, okay? And place oxygen on the patient fast at high flow, okay? Call the rapid response team. Start CPR if needed. If they ain't breathing, if they don't have a pulse and they're not breathing, you're going to start CPR until help arrives, okay? You want to place them in the Trendelenburg position. This is going to get that blood to go up to the heart. Trendelenburg, so this is their head. It's going to go down. It's going to push that fluid up to the heart, okay? If they're vomiting, you lay them on their side. If they're overweight, you can lay, it's hard to move them and things like that. I'm just saying, they're on the floor or something like that. Get a chair and put their feet on the chair. You can do it that way. Then you want the first line drug to use is epinephrine. It's important to know where epinephrine is where you work, because the strikes, you need to be able to readily administer that. When you administer it, you're going to put it in the middle of their thigh. You're going to hold it there for 10 seconds. Oh, I'm mixing it up with 10 and 3. Oh, yeah, sorry. You're going to put it in the middle of their thigh, and you're going to hold it there for 3 seconds, and then remove. Then you're going to massage the site for 10 seconds, okay? Call 911 after you administer epinephrine, because epinephrine, it's going to dilate the airways so they can breathe. It's going to cause vasoconstriction of your vessels too. It's going to increase your blood pressure. But even though you administer epinephrine, you still need to call 911. They're going to need fluids, okay? Because all their fluids in their vascular system is rushed into their tissues. They don't have no water to smoothly push that blood through, okay? So know that. Administer per MD orders IV fluids, albuterol, antihistamines, and corticosteroids. So if the doctor gives you some orders and say, give furosemide, why would you give furosemide, which is going to further deplete the patient of their fluids? They already ain't got none. Why would you put them on furosemide? So just make sure that the orders are making sense. You want to stay and monitor that patient, because even though things are resolved, you want to stay there, because biphasic anaphylaxis, BIPHASIC, biphasic anaphylaxis, it's hard to say that. can occur. And this is when, after their initial reaction, another one comes on, even though the antigen has been removed. Even though you remove the drug, the penicillin, the peanuts, the shellfish, they can still have a reaction even though it's gone. So you want to stay with them. You want to teach them teach them to avoid triggers that will trigger that reaction. If you're allergic to peanuts, don't eat no peanuts. If you're allergic to contrast dye, let somebody know. Don't go get that procedure. Ask for an alternate. I can do, use a different dye. You want to wear an alert bracelet to let somebody know that you're allergic to something and that you need your epinephrine. That's going to help you, because you just fall out, somebody going to think you just hot. Other than you have an allergic reaction and can't breathe, that alert bracelet can save your life. And you want to carry your EpiPens always, because you never know when you will get this situation can occur. All right, that wraps up for anaphylactic shock. You learned something.